Morning, everyone. Welcome to the Lynn Cancer Institute updates, keeping you in the know in 2024. Very grateful to have you all with us today and to learn from our very own oncology clinical dietitian, Marie Morande. Marie will be educating us today on culinary pharmacy. I'm especially anxious to hear about that today. As you can hear in my voice, I think I'm going to be able to use a lot of Marie's tips. So I apologize for my voice, but hoping to hear all the tips that I can use today. At the Lynn Cancer Institute, we believe that nutrition education is a basic tool in the prevention of illness, as well as so important in the management of our health. A few notes prior to Marie's presentation. Her bio was sent to you by email. We invite you to please take notes. Marie always has a lot of information. So at the end of her presentation, please put any questions in the chat box or the Q&A box, and she'll have time at the end to respond to all of our questions. So we're very happy to welcome you to the Lynn Cancer Institute and to introduce Marie, who's a familiar face to all of you. Welcome, Marie.
Thanks, Jan. It was a very nice introduction. And I apologize for that. I was on mute. But yes, today we're going to discuss culinary pharmacy. I appreciate you all in joining me. I also appreciate the fact that you guys continue to return and listen to me. I've been here for almost 16 years now, and this is my favorite part of my job, which is just talking to you guys and doing these presentations. So our goal today is to review some natural remedy, using whole foods in the management of some general ailments that are common to cancer treatments. We're going to get started. As far as digestive aids, cancer treatments can have a significant impact on our digestive tract, including most commonly nausea, gas, bloating, change in bowels. So it is possible to manage some of these nutrition impact symptoms with foods or spices. It may not be 100% effective, but it can certainly offer some relief or reduce the extent or of the symptoms themselves. So foods and spices that have digestive aid properties can help to soothe this discomfort while the body heals from the treatment. So kind of our goal today is to discuss these types of foods and herbs. So digestive aids can help in nausea relief, GI distress, taste changes. We're going to talk about sore throats, and any of these types of side effects to treatment. Nausea relief being the most common that people experience during their cancer treatments. And ginger being one of the most common recommendations for help with nausea relief. And we can do this in many different methods or forms. Ginger can be in the form of crystallized candy or hard sucking candies. You can use ginger tea. Ginger ale, of course, adding ginger into food. So I've picked up ginger roots in the past in just about any grocery store, and you can peel and slightly grate them into drinks or into hot cereal or into rice dishes or foods in general, just to kind of provide that relief or that form. Gingins or tummy drops are nice to keep in your pocket for if you're out and about and you all of a sudden start feeling queasy and can't run to grab something to eat right away. You can suck on those candies to kind of give you a little bit of relief so that when you do find a little snack or food, and I would suggest within a half an hour or so finding something to eat, that will settle well and you will feel better and be able to eat better. Cinnamon actually is also helpful for managing nausea. So, in the past, when my stomach has bothered me, I've had gastritis, the pumpkin muffins, cinnamon in hot cereal can be helpful. Cilantro, cardamom, and nutmeg are also very helpful with nausea relief. So some people will make various teas, or they could just take some hot water with some, cardamom, nutmeg, cinnamon. You can make a chai tea, which is great because it includes all those spices already together. And sip that on its own, or make a chai tea milk with a little bit of milk or almond milk or something like that feels like it would be soothing to the stomach. So certainly add these spices into food or using teas. Other types of GI distress, allspice is very helpful. Bananas and apples, as far as the pectins, once they are cooked, are very helpful for the GI tract, the gut microbiome, for managing diarrhea often, but just for normalizing stools. Interestingly, a bay leaf in your tea or in your cooking, we kind of all know that we don't eat bay leaves, but adding that into the cooking or into a tea can release, the nutrients from the bay leaf and help with GI relief, cramping kind of disturbances. Caraway is effective. Cardamom, very interestingly, if you buy the whole seeds, cardamom seeds, you can chew on those, and it's supposed to help with gas or stomach aches. Again, like I said, you can also use that in drinks or cooking. Cinnamon, cilantro, cumin. Mint actually has been promoted to help with IBS types of symptoms. So relief for gas, bloating, diarrhea, those kind of issues. We'll also talk about that as being helpful with taste changes. And nutmeg, lemongrass, saffrons, all of those are just kind of good and soothing to the GI tract. Eating fennel, eating buckwheat, eating yogurt, eating fermented foods are, all good as digestive aids and to help with that digestive distress, GI distress. Blueberries are typically good for the GI tract. Anise is another type of herb or spice, and of course ginger. But in addition to all of this, many of these things are basically working partially because they're supporting the healthy microbiome. And I've talked about the healthy microbiome quite a bit in the past, but it really makes a huge difference on our overall health. More and more research is coming out on the impact that our gut bacterial diversity have on the immune system, because that is basically our first defenses and our primary site of our immune system, as well as brain health and liver health and even management of blood sugars and reducing the risk of cancer actually all kind of ties into that gut diversity. So the better microbiome diversity that we have supports, a lot of this. So oats and pumpernickel and barley, as far as grains, can help to support a healthy gut microbiome. Adding seeds. So if you say, for instance, we're doing a cooked cereal, oatmeal or cream of wheat, and we add little flax seeds or chia seeds or something along that with a little blueberries, a little cinnamon, we can build a very soothing, very healthful a breakfast bowl. Legumes, lentils, peas, corn, potatoes, plantains, the bananas are all, like we've said, good for the GI tract and helpful to soothe that GI distress that can come along from a lot of treatments. The interesting thing with potatoes and rice is that when we cook potatoes and rice and then we cool them, it actually changes some of the structure of the starches in that food. And we form what's called resistant starches. Those resistant starches won't be absorbed as much, so it's not so much of an impact on our blood sugars, but they'll also be a good fuel, prebiotic, as we all kind of have heard, for the gut bacteria, and that will feed the good bacteria, forming those short chain fatty acids that are so helpful and so important for our gut microbiome. And then another interesting thing is to cook with turmeric or take curcumin supplements. Turmeric has been studied a lot, and it's kind of always been a strange dichotomy here, or situation where we know that turmeric is related to some very significant health benefits, lowering blood pressure and reduce cancer risk, and anti-inflammatory as far as arthritis and different inflammation related diseases. But we also kind of know through research that it's very poorly absorbed, as far as the bioavailability, as we say. So it's really kind of been a confusing for researchers to say, well, how is turmeric impacting our health so well if we're not seeing turmeric being absorbed into the bloodstream? And what they're finding is that, there are things that improve the absorption of turmeric, like black pepper, especially, but they also find that turmeric is directly used by the gut bacteria and activated by the gut bacteria and used to improve the diversity of our gut. So certainly very important in all of that, and be able to activate that and then absorbed as other types of nutrients into the bloodstream. So that was very interesting kind of update on the benefits of turmeric. So high fiber foods supporting that gut microbiome. We've kind of gone all over all of that: broccoli, peas, your cruciferous vegetables, your fresh fruit, your whole grains for sure. Other types of side effects that we see from chemo or radiation that impact our patients: taste changes, dry mouth, sore throat, and increased risk for colds and flu. And then even just in general, like Jan mentioned, and cold and flu season, what can we do? So for taste changes, interestingly enough, I often talk to my patients about finding flavorful foods, finding things with strong flavors and strong, to kind of mask, so to speak, maybe some of the taste changes or come through from the dulled senses of our taste buds in our mouth. So basil has been helpful for some people as far as managing those taste changes. Lemon or lime, of course, being a very sour flavor, kind of helps with some things. There's been a lot of talk of even just if you're worried about the acidity of the lemon or lime, even just drops onto the food can make a big difference in just freshening the flavor, and you don't have to use a ton. Cinnamon, again, mint is a very strong flavor. It's very refreshing in the mouth, so it can be very effective in managing those taste changes. And mint is great, breaking it up and adding it onto fruit or adding it into a a cereal or a drink or, anything like that that might, kind of benefit from that. Sea salt, I often recommend instead of table salt, which tends to be depleted of nutrients and more processed. Your sea salt has more minerals. It is good for hydration, along with improving, obviously, that flavor of food. And of course, ginger, teriyaki, onion, garlic, all of those flavors hopefully will come through. So any types of foods that use these ingredients, like Thai meals or Chinese, or would probably work better in the situation with adult taste changes than others. A dry mouth has to be very difficult. I've always found it very hard to manage dry mouth. We've always recommended the lozenges or the hard candies, like a lemon drop or something very sour or sweet to suck on, and just that sucking activity can stimulate the saliva production and hopefully start to moisten the mouth. But interestingly enough, people have found that mustard seeds just on your tongue can increase the saliva production. As I mentioned, lemon drops or lemon juice in your water can help with dry mouth. Papaya actually can also help with dry mouth, or people who have a lot of mucus sometimes too. Papaya has some natural enzymes that break some of that mucus up, or and then of course the lozenges with glycerin or something along those lines. So hopefully that will help with some of the dry mouth as well. The sore throat, certainly if you have a bad sore throat, take pain medicine, take Tylenol, liquid Tylenol, something like that. But again, basil can help with that sore throat. Honey, of course, helps with the sore throat, helps with that cough. I always try to encourage a local honey, a raw honey, so that you do get the immune benefit and immune support for the local bacteria and viruses and things that we're exposed to. Tea with lemon, honey. Interestingly, the old wives' tale of chicken soup actually has some medical benefit to soothing the throat, to loosening the mucous membranes in the nose and everything like that. So a true chicken soup, much like the talk of bone broth. So bone broth is made by a very slow cooking of the carcass of the bone itself, either chicken or beef or whatever. And it releases a lot of the marrow and a lot of the proteins and a lot of the nutrients from that, minerals and stuff from the bone itself. And those all can be beneficial, like I said, to relieving mucous membranes and improving the immune system and boosting the immune system. So, don't shake off the real chicken soup along with the broth. To fight colds, lemongrass is helpful. Cumin is a great spice. Lemon, of course, or lime. Basil, turmeric. So as we mentioned, turmeric is anti-inflammatory. It's antimicrobial, so it can help fight bacteria and viruses, along with boosting the immune system. So all good. So many options, like I said, making teas, adding these things to food. There are recipes out there for like golden milk, which I found to be a nice way of getting turmeric and even some of these other spices like cinnamon and nutmeg and cardamom and stuff. So golden milk is just a powder. It does have a little black pepper in it, so there's a little bit of kick. Add it into a warm milk. Can boost the immune system. It gives you that turmeric. It gives you a lot of these options. And warm liquids are always kind of very soothing to the throat and help to fight the cold. So and other potential side effects to treatments that I kind of wanted to talk about was regulating blood sugars, because a lot of people, because of steroids or dexamethasone that they're given with treatment, can run into issues with higher blood sugars, especially if they're already diabetic. And then high blood pressure can be in effect, hydration, things like that. So some survivors are on treatment or just coming off of treatment, or while you're on treatment, may have elevated blood sugars from the steroids. As I mentioned, there are food and strategies to help to regulate those higher blood sugars. And, we always start off with foods that are high in fiber and high in protein. Healthy fats are helpful because that does slow digestion down and slow the increase in the rise in the blood sugar after a meal. So your nuts and your almonds, especially, but any type of nut will give you those healthy fats. Avocados will give you that healthy fats. Olives, and, those are your kind of go-to for your heart healthy fats. Barley, interesting, is a higher fiber, or good a whole grain. Beans and lentils, even though beans and lentils have some starches, a lot of those starches are either fiber or resistant starch, which doesn't impact the blood sugar as rapidly. Cinnamon can be helpful in regulating blood sugars. Added into food, it can help keep the rise in the blood sugar lower. Dates are related to the beta glucan, can slow digestion. Again, it's higher fiber carbohydrates, so it slows digestion. Offers a way of making a sweet food, so to speak, healthy and not so impactful. Chickpeas, again, like the beans and lentils, high fiber carbohydrate. Actually, obviously vegetables and high fiber fruits. Usually I suggest the whole fruits versus any juice or cooked, unless you need that. And then turmeric actually can help regulate blood sugars, reduce inflammation, which often is related to the steroid, but also the inflammatory response in our body often increases blood sugars, increases insulin resistance. So when we can manage inflammation with diet and exercise, then we can also manage our blood sugars. Blood pressure can become a problem. Foods high in potassium can help manage high blood pressure, along with limiting sodium in the diet. So eating things like apricots and kiwi, green leafy vegetables, raisins, mushrooms, artichokes, cantaloupe, beets, sweet potatoes, garlic and avocado. So all of these things are high in potassium and have been shown to help with managing our blood pressure and with that supply of potassium. So, reducing the risk of cancer recurrence is always on people's minds. So even as on treatment or after treatment, we always want to make sure this is not going to be a problem again in the future. So there's been studies looking into the nuclear factor kappa as a protein complex involved in immune and inflammatory processes. So research is going on as far as this pathway, how it can be regulated to turn off genes that promote cancer, and targeting that pathway, like I said, which regulates the genes involved in many of the cancers. So inhibiting this pathway is promising as an anti-cancer treatment. So they're looking into studies of this, and, as I mentioned, but they're also have found there could be some foods or spices that regulate this pathway, and it's part of how these types of foods and spices reduce the risk of cancer and cancer recurrence. So this specifically, again, the anise, the basil, the black pepper, the caraway, cardamom, cilantro, cinnamon and cloves and cumin, fennel, ginger, mint, nutmeg, oregano, parsley, rosemary, saffron, and turmeric. So all of these foods, again, for this reason and many other reasons, as immune boosters, help to reduce the risk of cancer. So other foods, apples, and we mentioned apples as far as being good for the GI tract, especially when cooked. The apple skins are the best source of quercetin. So when we can't eat the whole apple, some people with GI distress may not tolerate the skins of the apple, but when you can, that's the best source of the quercetin as an antioxidant in the apples. Apricots, again, for the potassium, asparagus for vitamin A, vitamin K, folic acid. Avocados, as I mentioned, with those healthy fats. Barley, interestingly enough, with the fibers, along with being good for blood sugar management, can block estrogen receptors. So it can help to control those hormone related diseases. Basil can actually reduce some of the effects of radiation on healthy cells. So using basil in meals while you're on radiation can help protect our good cells from the effects of that radiation, hopefully. Beans, of course, the fiber, especially in colon cancers, to reduce the risk. Your cruciferous vegetables, again, indole-3-carbinol as one of the components to broccoli, kind of blocks and weakens estrogen. In addition to that, with the fiber and the various vitamin A and vitamin C components, again, make those kind of foods a superfood. Carrots, squash, sweet potatoes for the bright orange flavor or color. For vitamin A, again, is an immune booster. So would even help, of course, with colds and flus, but can reduce that risk of cancer. Cherry, you need your berries, cherries, cranberries, eggs, the flax seed, the sesame seeds, again, for those healthy fats, the lignans, the fibers. Green tea is very potent antioxidant, could have, certainly would boost your immune system, help with those colds and flus, but has been shown to reduce the risk of certain types of cancers, along with your omega-3 fats that you're going to get from fatty fish and walnuts. Mushrooms have been studied quite a bit as far as anti-inflammatory benefits, and there's a lot out there as far as different types of mushroom supplements, mushroom coffees. I like to just buy mushrooms and add them into my cooking. But I think any way that we can do that certainly has its health benefits. Pineapple for the vitamin C. Interestingly enough, the effects of smoke and grilling, we all kind of know can increase the risk of cancer. But if we have parsley, either in the marinade or in foods along with, these cooked foods, may help to counteract some of the harsh effects of smoke in our areas. And then pomegranate, of course, can boost the immune system. So I've always mentioned that turmeric you want to pair with black pepper. We've mentioned that already. Tomatoes, good in the sense of vitamin C and as a raw vegetable, but cooked tomatoes have been studied the most with prostate cancer and reducing the risk of and acting as an antioxidant for the prostate. Garlic can inhibit, of course, and when we're looking for sweeteners, I think the dates is a great idea for making various desserts. Date and walnut balls we've done in the past. We've done brownie bites with dates as a nice little chocolate treat with cocoa and everything, so you get that benefit. But Manuka honey or local honey as a sweetener may also help to fight cancer, along with being a lower glycemic sweetener and boosting immune system from the local environment. So when we need that sweetness, that's what I always kind of go to is that honey. So I like to remind people of the Mediterranean diet pyramid because I think way back when I was early dietitian and learning in school, we had the food pyramid, and that food pyramid was bread across the whole bottom. Um, and I appreciate the fact that a plant-based diet is really truly the base of a plant-based diet is fruits and vegetables. So if you look closely on this, you're looking at 4 to 5 vegetables servings a day and 3 to 4 fruits. And whole grains are there, certainly 3 to 5, servings a day or pasta and then interestingly enough, the Mediterranean diet suggests beans once or twice daily, and your other meats are more infrequently throughout the week. So I like to emphasize that your healthy fats, of course, olive oil and nuts and avocado and seeds and olives and stuff throughout the day. Fish 2 to 6 times a week, and then your fatty fish a couple times a week. Asian mushrooms. So it's a classic example of plant-based diet, kind of that gold standard when it comes to an overall healthy diet. So hopefully I'm sure you guys have a lot of questions. I'm happy to answer that. But as a survivor, or even just as you're going through treatment, we need to eat to nourish. We need to move for sure to help you thrive and enjoy life. And I hope some of this is helpful as far as managing those side effects to chemo. So thank you all for coming. And if there's questions, you can put it in the chat or the QA boxes.
Marie, there's a couple in the chat box from me.
Okay. Let me go back to the. Oh, and I had mentioned to Jan privately that a nice idea for immune booster would be if you have a magic bullet or a blender or something, taking lemon juice, ginger, honey, kind of making your own ginger shot, so to speak. We see that a lot in the stores, and they're terribly expensive, but it's not that expensive to have lemon juice or the honey and the ginger. So putting it all together, blending it together. You could add turmeric if you wanted to, the black pepper, any of that kind of stuff, and having them in little containers where you can take it with you or take that little quick shot in the morning. Yes, so why green bananas? More than likely green bananas because they're not quite as ripe, or the sugars are not as developed. So when something is ripe, in the same way that we talk about al dente pasta, in the green banana, the starch is not quite as developed, so it's harder to break down and digest as far as blood sugar management than a ripe banana. So the green bananas, in that sense, have more resistant starches than for the gut microbiome, and the bacteria can digest that and fuel and use it, and it won't spike your blood sugars as much. Rice and potatoes cooked and cooled, can you reheat? Yeah, you can reheat them, or must they be eaten cold? I think you can reheat them, but I think the example a lot of people give is doing like rice salads or potato salad. Interestingly enough, how they talk about how potato salad's not all that bad if you find a decent way of healthy fats, of course, to make a potato salad. But the act of cooking and cooling them and then serving them in that cold state activates more resistant starches, so it's not as much of an impact on blood sugars.
And there's a couple in the Q&A.
Oh, yes. Sorry. Always put lemon in water. Particular type of olives is best. I don't have a preference on olives. Certainly we have to consider salt and things like that as far as olives go, but I don't think I haven't seen anything as far as the difference between black or green olives. Um, Always put lemon in water. You don't have to always do anything, but lemon in water can be helpful for the taste changes or the stimulating saliva production or just a little bit of that lemon to boost the immune system, things like that. Do we need to eat yolks of eggs to get what we need? Um, I personally would suggest a whole egg. I believe there's a lot of good nutrients in the egg yolk that we do need. I think the concept of doing egg whites only has kind of evolved out of the idea that eggs have cholesterol and that raises cholesterol, and that's all been disputed um, a lot recently or for quite a while now. So, especially if you're going to buy free range eggs or, organic eggs or, um, any of those, or even Eggland Best, you want to eat the whole egg because all of the nutrients benefit that you're going to get from those type of situations are going to be fats in the yolk. So if you're only eating egg whites, then that's fine. But I don't know what happened to my slides, but I'm sorry about that. But I would eat the whole egg. I'm sorry. And the slides will be emailed to you. I've already made a PDF to send to Lee, and she can attach that to her email. And typically the recordings are uploaded onto our website. Lee, did I miss any?
I don't see anything else.
Going on with my
Any other questions? As always, Marie is so comprehensive in her research and presentation to us. So thank you so much, Marie. And also
Thank
for your
you.
generosity in sharing your slides, because I like to go shopping with your little list. It really is helpful to have it handy. So as Marie mentioned, this lecture, as all of them, are recorded. So we like to do that so you can go back and listen again, and so that you can share it with family, friends, coworkers, anyone who was not able to make it today. And Lee will send out the link to you along with an evaluation. And we really appreciate you completing the evaluation. It helps us to know, excuse me, some of the topics, if you want to add topics that you'd like to hear about. And we can also add your name to our database so that you'll be on the mailing list for all of our lectures. And I'd like to let you know what our presentations will be for the month of June. And on Friday, June 14th, we're going to have a presentation based on our survivorship series. So this one will basically be for our cancer patients and survivors. The topic will be long-term side effects. Sorry, need to get my tea. Long-term side effects of radiation oncology. And Dr. Sam Richter will be will be the presenter. That will be at 12 noon on the 14th. And then on Wednesday, June 26th, will be our monthly presentation from our dietitians, our nutrition lectures. The topic will be nutrition and exercise from prevention through survivorship. This presentation is good, definitely good for our cancer patients, but also anyone of us that would like to prevent cancer. Very comprehensive presentation. And this will begin at 11:30 a.m. until 12:30 on the 26th of June. So thank you, everyone, for participating today. Thank you, Marie, as always, for your research and your wonderful way of presenting. And it looks like there might be one other question in the Q&A. Oh, thank you very much. So thank
You're
you,
welcome. My
all of us.
pleasure.
Thank you, everyone. Have a great afternoon.